So my name is Nuala Hampson. I'm the pharmacy lead at the Centre for Sustainable Healthcare, and I want to talk to you today about prescribing and pharmacy practice through a green lens, and hopefully give you a bit of a broader view on how we can be more sustainable in our day-to-day practice. So the Centre for Sustainable Healthcare, if you haven't come across it, we are a charity founded back in 2008. Our aim is to inspire and empower people with the knowledge, skills and tools to play their part in the transformation to sustainable healthcare. We currently work mainly across the UK, but we're also involved in significant research projects across Europe. We've worked extensively with a range of national teams in Wales, including green teams at Swansea Bay University Health Board and Hywel Dda University Health Board, and Cardiff and Vale, Cardiff Medical School are SUSQI beacon sites. So I know from my work at CSH there's a huge amount of amazing work going on in Wales, so we'll really encourage you to share that. So what I'd like to do today, first of all, go back to a little bit of basics, and I'm sorry, we need to kind of talk about the scary facts, look at the interconnectedness of planetary health and human health, but we need to understand those facts in order to take positive action going forward. And I'd really like to inspire action in everybody, encourage you to use your voice. And I'm going to just sort of talk through CSH's principles of sustainable healthcare and sustainable value, and provide you with some examples as to sort of what's happening already. But to start, just a little bit about me and sort of my background and my sustainability journey and how I find myself kind of here today talking to all of you in Wales. So my background is in primary care. I worked in primary care for about 20 years, starting off as a prescribing advisor, and then spent about 15 years working as a practice employed GP practice prescribing pharmacist, doing medication reviews and all the rest of it that I'm sure all of you are busy doing every day. Alongside that, I also developed a role in education, mainly in postgraduate pharmacy education. So this picture that you can see on your screen is my favourite place on the planet. So this is a remote little village called Downings in the far northwest corner of Donegal. And really this represents to me kind of why I'm here today and the things that I want to protect, if you like. So as you can see, this place is somewhere where it's very easy to be close to nature because nature is all around you, and it's a really stunning, beautiful place. And it's a place where I have a lot of family ties. So the people there are really important to me. It's a place where I visited every year of my life, apart from during COVID. And during COVID is kind of when I had that light bulb moment and things changed for me and my career really pivoted in terms of sustainability. So I couldn't visit Ireland. I couldn't go and visit my family. And so for the first time in my very privileged life, I realized that actually things might not turn out to be okay. And I'd also always been concerned about environmental issues. I joined Friends of the Earth when I was 14. But I guess I always thought, I'll do my little bit, but, somebody else will sort it out and it will all be okay. And I think during COVID, we all kind of realized that actually things might not be okay. So that was kind of a bit of an awakening for me. And during that time, I also listened to a podcast by Katharine Hayhoe, who's a climate scientist in America. And she said the most important thing that you can do about climate is to speak about it, because people don't talk about it. And that really gave me pause for thought to think about, where do I have a voice and where do I have power in that voice? And I realized that was at work. It was in my professional life. And at that time, I was working at CPPE, and I talked about this at one of our team meetings and sort of my concerns about the climate and the relationship between health and kind of what we were doing and how prescribing sort of contributes to it. And I found that lots of people empathized and felt the same and were worried and wanted to do something. So we ended up with a bit of a greener CPP group. And then I found people were looking to me for answers and kind of seeing me as an expert. And I'm like, oh my goodness, well, I'm not an expert at all. So I went to find some learning and further my education around sustainable healthcare. And that's how I came across the Centre for Sustainable Healthcare, attended a number of their excellent courses, the first one being Sustainable Primary Care. And as a result of that, I went to volunteer for them and eventually ended up working for them. I still have a role with CSH. It's a voluntary role now where I do a day a week as their pharmacy lead. And I now also work at the University of Sheffield. I no longer work in clinical practice. My sort of focus now is education and really primarily ensuring that we embed education for sustainable healthcare across the pharmacy undergraduate curriculum and across the pharmacy profession as a whole. So that's really what my aim in life is at the moment. And again, why I find myself here today. Still got imposter syndrome though, so I'll just let you know that now. So the one thing I would encourage you to do, the first thing I'm going to encourage you to do today is to use your voice. I didn't have any expertise or any sort of real level of power or authority, but I found that talking about these things and talking about what I was doing had a real impact on people. So I'd really encourage you to find your voice and to use it and to think about this sort of across what you're doing, both in your personal life and in your professional life, whether that's looking at sort of processes, within your practice, where it's thinking about sort of advising patients around sustainable use of medicines, where it's getting involved maybe on a more personal level, thinking about maybe where you have a voice in relation to maybe local community groups, or your kids' schools, or sort of whatever you can make a difference. I would really encourage you to try and do that. And this is why we all need to use our voice. We are in the midst of a triple planetary crisis. We can feel it today in the temperature. And there is real urgency now that we take widespread action about this because time is running out. So the next few slides are fairly sobering information, but if we all know it and we face up to the challenge that we have in front of us and we work together to address it, that is so much better for us individually and collectively than kind of sticking our heads in the sand and thinking, oh yeah, somebody else will do it, or this is too big for me to deal with. We need to face that challenge in front of us. So on a very basic level, climate change is caused by burning fossil fuels. This increases the level of carbon dioxide in the atmosphere. It creates an insulating blanket around the Earth, which results in warming of the planet and destabilization of the climate. And this presents itself then in various different ways. So one way is extreme heat, which we are obviously experiencing right now. And this slide from Hawarden is from a few years ago when the maximum temperature in Wales's record was broken. And I have no doubt that that record will be broken again this year. Many records were broken in May for the hottest days in May. We are now in our third heat wave of the year. And here in England, the kids haven't even got off school for their summer holidays yet. So extreme heat, as well as being really uncomfortable for us, is actually a direct health impact. It causes heat exhaustion, heat stroke, and death. It has impacts across the entire population, but also particularly in vulnerable groups, so the very young, the very elderly, those with multiple conditions, particularly heart and kidney conditions, those living alone in urban areas, those who are homeless, those who need to work outside. It presents unbearable working conditions, and I'm sure many of you work in GP practices that have no air conditioning, as I did, worked in a GP practice for years where the radiator was stuck on high, couldn't get it switched off. And we've seen really terrible conditions across hospitals across the UK over the last few weeks, and the Doctors Association of UK has written to the Health Secretary in the last few days about the risks to both staff having to make difficult decisions when they're overheating and them not being able to keep patients cool and when patients are coming into hospitals already unwell. Our infrastructure is not built to deal with this heat, and we've seen breakdown of IT equipment and MRI scanners, and also general disruption to travel, particularly across rail services. And obviously the heat also provides challenges to the supply chain, and both global and local supply of medicine and storage of medicine. So for example, what are people doing with their medicines day to day? If they're carrying their medicines around with them, it's 32 degrees outside here. If they're storing their medicines in their car, we really need to be thinking about how we can advise patients about how they keep cool in this weather and how they store their medicines appropriately. I can guarantee that every person in the UK today knows where the coolest room is in their house because it's the one we're seeking out, and that's where their medicines should be. Flooding is also a significant issue, and this picture is from Gordon's Chemist in the High Street of Newry, which is a town in Northern Ireland, from 2 years ago when the whole town flooded because of excessive rain, and they lost all of their stock. Again, flooding has a significant mental health impact on those who are victims of flooding, increasing the risk of anxiety, depression, and PTSD, which can last for many years after the flooding incident. And often those exposed to flooding are exposed to it repeatedly year on year because they are the ones who cannot afford to move, cannot afford to get insurance, so has really significant impacts on mental health. And again, affects our ability to provide services if people can't travel to our GP practice because the roads are flooded, and can also affect supply chain disruption, so supply of medicines, etc. And the public are aware of climate change and they are aware of the impacts. This survey is from a few years ago in Wales, and 82% of the population who were surveyed in Wales said they were fairly or very concerned about climate change. 61% at that point, and this is about 4 years ago, believed that climate change was already having an impact in Wales, and over a third had had direct experience of at least one of these effects. So the public get this, and increasingly people have personal experience of the impacts of climate change. I think that we sometimes worry about talking about climate change, but actually people want to talk about it and they want to know what to do. So we have a responsibility to inform our patients around it. So a healthy planetary ecosystem provides us with our basic needs for survival: clean water, clean air, healthy soil to grow our food, and it also provides us with many of our medicines. The UK is one of the most nature-depleted countries on Earth, and the UK government has now recognised that biodiversity loss in the UK is actually a national security threat. Biodiversity is a national infrastructure. It's not a nice to have. Without it, we simply cannot survive. So we need to be thinking about every action that we take and what impact that might be having on biodiversity and what we can do to increase and encourage that biodiversity around us. Pollution, I could spend the entire hour just talking about pollution, but very briefly, air pollution is the most significant public health impact that we're currently facing. In the UK, there's around 36 to 40,000 deaths a year related to air pollution. It impacts the entire population at every stage of their life, and it's not limited to respiratory effects. Pharmaceutical pollution is a really significant issue in terms of waterway pollution. The majority of that is from excretion of drugs after we've taken them appropriately, but there's also inappropriate disposal of medicines down toilets and sinks. And we really don't know the human impacts of pharmaceutical pollutions. Our water sewage systems are not built to treat and manage the complex active pharmaceutical ingredients, and we don't really know what impact that's having on our health. What we do know is that it's contributing to local and global antimicrobial resistance, as antibiotics are commonly found in our waterways. And we also need to remember plastic pollution. So many of our medicines, devices and packaging are made of single-use plastic, which is very difficult to recycle or reuse, and this also has a significant contribution to pollution. So we are in the midst of a triple planetary crisis. It is here and now. We can feel it in the heat that we're experiencing today, and it's progressing faster than predicted. And we know that we need urgent system-level action to address this, in addition to our individual action. So one thing I would ask you to go away and look at, if you're not already familiar with it, is the National Emergency Briefing on Climate and Nature Crisis. So this was a briefing undertaken by experts back last November, where they presented the facts, very objective, very scientifically based facts around the impacts of climate change here and now in the UK, and importantly, the solutions that we have and what we can do to address them. If you go to the National Emergency Briefing website, you can find those individuals' talks. They're all on YouTube, and I would really encourage you to watch the one on health presented by Hugh Montgomery. But what you can also do is host a screening. So this initiative has generated a 50-minute film for public consumption, and they're encouraging individuals to host screenings around the country. It's a really easy thing to do, and I would really encourage you to do it within your practice or your health board. We did one recently at the University of Sheffield, really simple to set up and run. And the aim is to educate the public on the significance of climate change, what the impacts are, and what we can do about it. And to do that in a way similar to how we dealt with COVID. And if you remember back to the early days of COVID, you know, we had a daily update on the news from Professor Chris Whitty. We understood the risks. We understood what we needed to do to minimize those risks. And certainly in the early days of COVID, you know, as a nation, we really came together to kind of work together and support each other and to work through it. And that's really what this initiative is calling for, that level of information and guidance for the public. So I would really encourage you to go and have a look at that website if that's not something you're familiar with. The map just shows the screenings that are available currently, and I've just picked the ones around Cardiff because I know that's where you are today, but there's loads all around the country. So I encourage you to go and have a look at that. So there's kind of three key things that we need to remember in terms of this interconnectedness between planetary health and human health. The climate and nature crisis has direct impacts on human health. It's putting healthcare services at risk, so making it more difficult for us to provide healthcare services when people need it most. And healthcare itself is contributing to the climate and nature crisis. So every decision that we make has an impact. And this doesn't sit comfortably with our responsibility to first do no harm. So what can we do about it? So we can make changes in our individual lives and we can use our voice as a citizen to call for change. But what can we do within our professional lives as pharmacists and GPs in primary care? So what can we do about it? So we can make changes in our individual lives and we can use our voice as a citizen to call for change. But what can we do within our professional lives as pharmacists and GPs in primary care? And the first thing I'm going to ask you to do is to see the bigger picture. I hope that what I've talked about so far illustrates the interconnection between wider planetary health and human health, that everything we do, every choice we make throughout the day has an impact, and we should aim to be more mindful in our decisions. What impact is a choice I am making having on the climate right now, the environment, people locally or globally, and the animals that we share our planet with? And what can I do to minimize those negative impacts? And by striving to make the right choices when we can, because it's not always possible to make the right choices, this not only gives us agency and gives us hope, but it also encourages those around us to think about their choices through our role modeling. And as primary care health professionals, we really have a role. We are really trusted individuals within society, and people will listen to us and trust us, which is not the case for many other professions. So it's a real starting point for conversations to get people talking and thinking about what we can do together to minimize our negative impact on the climate. And so I'm going to frame this in sort of three separate areas. The first is sustainable healthcare, and then thinking about sustainable resource use, and finally connection with nature. So what is sustainable healthcare? It's the ability to provide healthcare to meet the needs of this generation without compromising the ability of future generations to meet their healthcare needs. So very much aligns with the Future Generations Act that you have in Wales. So we need to start seeing everything through that sustainability lens, putting on our green goggles and seeing opportunity for optimizing sustainable healthcare, which are in fact all around us every day. And as pharmacy professionals and primary care clinicians, much of what we already do is contributing to sustainable healthcare, as will see. So it's really about that more holistic view, thinking about the wider impact of what we are doing both now and for our future generations. And the Centre for Sustainable Healthcare has developed the Sustainable Value Equation and the Principles of Sustainable Healthcare to help us with this. So the Sustainable Value Equation is a way of delivering care in a way that maximizes positive health outcomes, not just for individual patients, but also for the population as a whole, through best use of environmental, social, and financial resources. So this is not an add-on. It's not something extra that you have to do. It's a way of looking at what you already do and thinking about the impacts and what are the outcomes for patient and population, and what impact, either positive or negative, is that having in terms of environmental, social, and financial impact. And at CSH, we use driver diagrams to help us to think about sort of specific clinical pathways and how we might sort of implement the principles of sustainable healthcare. So over here on the left, you'll see that what we want to achieve is high quality care with a reduced carbon impact. So we want to minimize the negative effects of healthcare and to maximize the quality of healthcare. So to do that, we need to firstly reduce the activity and reduce unwanted or unnecessary activity by thinking about prevention of disease, empowering patients to have better agency in their care, and having lean pathways, so stripping out any waste. And then the activity that we are left with that we need to do, looking at, well, are there any low carbon alternatives that we can use, and what resource use do we need to run those activities, and how can we sort of optimize that resource use? So The principles of sustainable clinical practice provide a really useful framework to see how sustainability applies to your day-to-day role, whatever area you work in, whatever your sort of clinical interest is. And they complement the principles of prudent healthcare. And you'll see that much of what I'm going to talk about aligns with the ambitions of the All Wales strategy for medicine, helping people to get the best outcomes from their medicine, to minimize harm, and to optimize value. So the first step is to look at how can you tweak your current approach, fit this into what you're already doing, rather than seeing it as an add-on. So sustainability is a lens through which to see things differently. So the first one is prevention, promoting health and preventing disease by tackling the causes of illnesses and inequalities. So we know that the health system is dealing with a huge volume of complex, chronic, non-communicable diseases. What we are not doing enough of is preventing that disease occurring in the first place. We need to do more to enable patients to prevent disease, placing more emphasis on prevention and lifestyle. And we need to upskill our future health professionals in lifestyle medicine. So when we're thinking about prevention in pharmacy and primary care, we typically think about things like screening for hypertension, high cholesterol, etc., vaccination, primary prevention of things like heart disease. And these are all essential aspects of disease prevention. But I'd like you to kind of step back and take a slightly bigger view. So the way we live is making us ill. You just need to look around as you walk down your high street to see that that is the case. The Major Condition Strategy, published a couple of years ago, lays out how 60% of healthcare activity across the UK and across the sectors is used up addressing these 6 long-term conditions. So respiratory disease, heart disease and diabetes, mental health, musculoskeletal disorders, dementia and cancers. And these are all caused by and or exacerbated by lifestyle factors. 64% of the UK population is overweight or obese, and children with an obese parent are more likely to be obese. 1 in 4 women and 1 in 5 men do less than 30 minutes of physical activity in a week. And in 2018, only 28% of adults were eating the recommended 5 portions of fruit and vegetables per day. And we know that actually 5 portions is nowhere near enough, as we'll come on to later. And 90% of the global population is exposed to air pollution, which exceeds WHO guidance. Significant and widening health inequality is impacting the most vulnerable within our populations, and the climate and nature crisis will only amplify these inequalities. So this is it's a big issue, but we have to start somewhere. And as primary care clinicians, we have a responsibility to give equal attention and emphasis to the things that people do every day that impact their health. And I'm really guilty of this. If we spend the majority of our appointment time talking about the medicines and the levels and the monitoring, and we mention lifestyle at the end as a bit of an afterthought, then patients won't think that lifestyle changes are important. They won't think that they can have a significant impact. But if we prioritize advice on diet, on physical activity, on avoiding environmental harms, then patients might pay more attention. And to do this, we might need to upskill our current knowledge, and we might need to employ some behavior change tactics to sort of help us sort of shift things, because what we're doing at the moment is clearly not working. And one thing I'd like you to sort of think about and maybe go and read up a little bit more about is food. So we cannot sustain the diet that we currently eat in the Western world. The population globally is currently 8 billion, predicted to be 10 billion people by 2100. And we simply cannot provide enough food for that population if we continue to eat in the way that we eat. So basic survival is at the source of this. The second thing is health. So we know that the diet that we eat in the UK is really unhealthy and is contributing to obesity and inflammation, which is leading to heart disease, diabetes, and many other diseases. Around 60% of the average UK diet is ultra-processed food, which we know is really high in saturated fats and sugars, is addictive, low nutritional value. We eat way more red meat and dairy than we need to, and we eat nowhere near enough whole foods and plants. So there's some sort of really key messages that we can share with patients around improving their diet, which will improve their general health, and as a side effect, actually also have a really positive impact on the planet. Because growing crops to feed animals, to then eat the animals, is a really inefficient way of producing food. And actually growing crops, particularly things like beans and legumes is actually really good for the quality of our soil, helping to maintain the soil so we can produce food in the future in comparison to pastures. So if you haven't heard of the Planetary Health Diet or the Planetary Health Plate, which was developed by the Eat Lancet Commission, I'd encourage you to go and have a look at this. So it's a diet that enables us to feed the growing global population. It's a flexible diet for better human health, and it's based purely on health outcomes, not environmental outcomes. And if we adopted this diet globally, 15 million early deaths could be prevented annually, representing a 27% reduction in adult mortality. We could massively reduce greenhouse gas emissions from agriculture by more than half, and free up lots of land for use in biodiversity. So the diet is rich in plants, whole grains, fruits, vegetables, nuts, and legumes. They comprise about 87% of the calories of this diet, and it allows for a modest amount of animal foods, including dairy, fish, and meat, depending on individual and cultural preferences. It limits red meat and processed meat and sugar and salt due to the strong evidence of the health risks of these types of foods. And it puts emphasis on unsaturated plant-derived oils rather than saturated fats. So it emphasizes a range of food values, providing flexibility and choice across foods. So we know that a better diet in combination with increased physical activity has the potential to save millions of lives and avoid or delay the need for healthcare until much later in life. So I'd encourage you to go and have a look at the Eat Lancet Commission. The Association of UK Dietitians have some really useful information on this, and the Plant-Based Health Professional Organisation summarises all of the evidence-based health impacts of a plant-rich diet. So some sort of really simple messages to share with your patients: try and cut out processed food or cut it down, and try and eat less red meat and dairy, and try and increase whole food plants. So try and think about sort of how you can sort of practically advise patients around that. You know, chuck a tin of green lentils into your spaghetti bolognese the next time you're making it. You know, up the plant proportion compared to the meat. Do it easily and cheaply. Air pollution is another thing that we need to be thinking about in terms of clinical practice. It affects everyone in the population and at every stage of life, and is associated not just with respiratory disease, but with low birth weight, diabetes, stroke, heart disease, and dementia. It's a significant public health risk, so we should reflect this in clinical practice by asking about exposure to indoor and outdoor air pollution when taking medical history or doing a medication review, by giving simple advice on how to minimize exposure to air pollution and advise patients on what to do when air pollution is particularly high, such as now during times of extreme heat. We can help patients to reduce exacerbations, reduce respiratory symptoms, and maintain better health. And we should also be taking a similar approach to extreme heat, so advising patients how to stay cool, how to keep their houses cool, and knowing when to seek help. So in addition to sort of giving that advice to patients, we can also be role modeling these activities, for example, by introducing plants in and around the practice, encouraging active travel, adding information on air pollution to your practice website. So closely linked to prevention is patient self-care, enabling and empowering patients to have more agency and responsibility in their own care. And this is really around person-centered shared decision-making and using the Brown approach that I know is included in the medicine strategy. So if you're thinking about starting a treatment or a medicine, having that open discussion with the patient around what are the benefits of this, what are the risks, what are the alternatives, and what if I do nothing? Setting realistic expectations for patients. So for example, patients with chronic pain, prescribing a medicine is not going to make them pain-free. They're going to have to live with a level of pain. So how do we enable them to do that and give them strategies to help them to do that? So as pharmacists and prescribers in primary care, we tend to default to prescribing as the first and often the only option. But this approach is not working. Prescribing levels are increasing year on year, 86 million prescription items per year in Wales for the year 2024-25. We know that 10% of medicines in primary care are overprescribed, and between a third to a half of all medicines prescribed for long-term conditions are not taken as recommended. And as prescribers, we know all too well the problems associated with overprescribing. We see it every day It's bad for the patient as it results in polypharmacy and adverse effects and unplanned admissions, which are costly to the NHS financially and the environment due to the carbon footprint of the manufacture and transport of medicines. And it's obviously costly to the patient as well through their ill health. So we need to be sort of stopping and thinking about what we're doing. Before we write that first prescription, what are we starting and what are the options? Are we giving lifestyle advice the same level of importance as prescribing? Are we giving patients a choice? Are we getting patients on board with those decisions? So if something goes wrong further down the line and they stop taking the medicine, that they let us know so we can stop prescribing it rather than those medicines being accumulated at home. And are we embedding sort of lifestyle interventions into our day-to-day practice and encouraging patients to do the things that they can do in their day-to-day life to help support their health alongside whatever treatment we are prescribing to them? So, for example, when we see postmenopausal women for their HRT check, as well as checking around their HRT and their blood pressure, are we talking to them about their diet, making sure they're getting sufficient calcium and vitamin D? Are we encouraging them to do weight-bearing exercise to strengthen their bones? Are we encouraging them at this point to sort of improve their balance and strength exercises so that when they get to the age of 70, that they're not falling over? If they're falling over, they're able to get up. So are we thinking about healthy lifestyle habits at every medication review, stressing that what people eat and their level of physical activity every day can have profound impacts on their physical and mental health and their well-being for their whole life? So then moving on to leaner service delivery, this is around streamlining care systems to minimize wasteful activities, so stripping out the waste in our systems. And this might involve a whole range of approaches depending on the setting in which you work. So it's ensuring that that cascade of activity that we engage in every day in healthcare is as efficient as it can be, whether that's around travel to appointments, thinking about the consumables that we use and blood tests and examinations, thinking about using remote consultations where appropriate, thinking about that whole process of prescribing, follow-up, monitoring, repeat prescriptions, medicines optimizations, and minimizing waste of medicines. So there's a couple of key issues I'd like to focus on, and one is the generation of medicines waste. So we know that in the UK, there's around £300 million worth of medicines waste generated every year. And that figure is now 15 years old, so likely to be much higher. So thinking about how do we stop that waste occurring in the first place is a really impactful way to optimize the environmental aspect of our prescribing. So thinking about the prescribing, is it needed? If we're prescribing something new, how much do we need to prescribe? Can we check the patient can tolerate this medicine before we give them 2 months worth and send them on their way? Is there a reusable version? Does it come in recyclable packaging? Enabling patients to manage the ordering system. So can they manage that repeat system? Can they order only what they need? Can they avoid that automatic ordering? And I know you're going to be talking about this later on today. Encouraging them to check their bag of medicines before they leave the pharmacy so that if there's anything they don't want in there, they can hand it back and it can be reused. Checking for stockpiling in patients' homes using the Show Me Your Medicines initiative, and really having that person-centered care approach. So patients will tell you when they're not taking the medicines. Honestly, if I had £1 for every time a patient came into me in my GP practice and said to me, well, I don't want to tell the doctor, but I'm not taking the medicine because I don't want to upset them, then I would be a rich woman. So having that relationship where the patients will tell you and then you can act on, whatever their concerns are or whatever it is that you need to do. And then also thinking about the end of the life cycle of the medicine. So we're very good as pharmacists and prescribers at the prescribing and dispensing and thinking about safe use and administration, but we don't tend to think about the end of that medicine. What do patients do if they've got medicines left over? How should they safely dispose of it? Are there any recycling options for the packaging or the devices that we're prescribing? And we really ought to be prescribing, advising patients about this every time. There's some really interesting studies around patient behavior around disposal of medicines. So this first one is around what patients are likely to do with medicines depending on the type of formulation that it is. So liquid medicines are most likely to go down the sink or toilet, whereas kind of creams and ointments are more likely to go in the bin. There's another study recently run by Tracy Lyons which looks at patients' behavior around medicines depending on where the medicines came from. So if the patient perceives the medicines to be toxic or more serious or strong, i.e. if it's come from a hospital, they're much more likely to take it back to the pharmacy for disposal. Or if it's just some paracetamol that they bought down the supermarket, it's much more likely to go in the bin. So we have a really easy, simple and impactful role here to always advise patients about taking any unwanted medicines back to their pharmacy and letting them see how inappropriate disposal of medicines directly contributes to environmental harm, which no patient wants to contribute to. I just wanted to briefly mention medicines waste in care homes as a specific issue. So of that £300 million of medicines waste, £50 million of that comes from care homes. We undertook quite a big project at CSH about 18 months ago on medicines waste in care homes. And you can read more about that on the website, and that's in the resources at the end of this presentation. But what we found was that staff just didn't understand medicines waste. They didn't understand why it was a problem. They didn't understand the environmental impacts. They didn't understand how to reduce medicines waste. So one of the things that we did was we created a 15-minute sort of education video aimed at staff in care homes, GP practices and community pharmacy around medicines waste. And that's really available on our website, and that's the QR code for it there. So if your practice is dealing with care homes, I would really encourage you to look at medicines waste issues, because it will be an issue in your care home. I can pretty much guarantee that. So then finally moving on to low carbon alternatives, and just to point out that the principles of sustainable clinical practice are listed in order of their impact and importance. So, we often talk about, low carbon inhalers, but actually all of these other things, if we do them first, have a much bigger impact in terms of optimizing sustainability than making low carbon switches. So it's obviously really important that we have a really clear plan for decarbonising our healthcare services, and Wales are ahead of the game on this and have a much more ambitious target than the rest of the UK. But we also need to be careful about that thing of carbon tunnel vision, where we're just thinking about the carbon and not thinking about the wider environmental impacts of whatever it is that we're doing. So this infographic is from one of our courses at CSH, which looks at the environmental impacts of any product. This is not about medicines in particular, and thinking about the whole life cycle of that product, rather than what we tend to think about, which is the point of use and maybe the point of disposal. It's worth noting that for the majority of products, 80% of the carbon footprint is used up before you even open the package. So that doesn't apply to inhalers or anesthetic gases, because their use involves direct release of greenhouse gas emissions. But that general rule applies to pretty much everything else in terms of medicine. So we need to be thinking about that whole picture from the initial extraction and manufacture. So for example, with generic medicines, many of ours are manufactured in India and China, where the guidance and regulations around pollution and waterways is not as strict as it is here. And there are really significant problems with waterway pollutions around pharmaceutical manufacturing sites. In terms of transport, we have global supply chains. So there's a really significant transport footprint, but actually often the most significant part of that footprint is when the medicines get to this country and are then transported over land within the country. And actually our project on the care homes, we found that medicines delivery was an unexpected carbon hotspot. So for one of our sites, because they used a community pharmacy that was quite far away, it was an internet pharmacy, and they had multiple deliveries every single day because the way they were working was really inefficient. What we found there was that the carbon footprint of the medicines delivery was higher than the carbon footprint of the medicines themselves. So really taking that wider view and looking at every step, you can sometimes make really significant changes. That site managed to reduce their carbon footprint of their deliveries really significantly just by changing some of their processes and identifying what was actually urgent and what wasn't urgent, and cutting down their deliveries by a third over a very short space of time. Really can't talk about low carbon prescribing without talking about inhalers, because obviously it's 3% of the NHS carbon footprints and something we really need to be aware of. And I know you have a lovely dashboard in Wales where you can look at your prescribing, which unfortunately I wasn't able to see because I haven't got the right access. But just a few key points to remember about inhalers. The propellants in metered dose inhalers and breath activated inhalers are direct greenhouse gases. Every time you press that canister, you are releasing greenhouse gases into the atmosphere. And some patients will need MDIs, and that is absolutely fine. The dry powder inhalers contain no propellant, so they don't have that direct greenhouse gases. Some companies are producing lower global warming potential propellants, which is great. They're still a higher impact than the DPIs. And some companies are promoting their inhalers as carbon neutral. Now, carbon neutral does not mean low carbon. What it means is that that company has bought carbon credits in another part of the world. So in the case of Lufthansa, the company that makes that has invested in renewable energy in China, which means they can offset the carbon presented by their inhalers. However, that doesn't make any difference to our direct kind of greenhouse gas emissions. Every time you spray that Lufthansa inhaler, you're spraying greenhouse gases into the atmosphere. So just being aware of the basics of the science behind this, and being aware of the sort of the advertising and the marketing and the promoting that might be going on. And also, again, thinking about that bigger picture. So it's all very well switching somebody to a dry powder inhaler, but if they can't use it and their asthma is not well controlled, then we know that poorly controlled asthma has a 3 times higher carbon footprint than somebody with well-controlled asthma. If they don't know how to store that inhaler and they just chucked it in the glove box of the car and it's 32 degrees outside, then that medicine is going to degrade. If it's an MDI, it might explode. If they don't know how to safely dispose of that medicine, if they don't know how to avoid their exposure to air pollution, then we haven't done that bigger picture job around sustainable healthcare. So we need to be thinking definitely, yes, about low carbon alternatives and minimizing that, but also thinking about all of those other aspects of healthcare activity. And another sort of quick win around sort of low carbon alternatives is thinking about solid or oral dosage forms instead of liquids. So generally speaking, as a general rule, liquids have a higher overall carbon footprint than pills, tablets, or capsules. That's because of their increased bulk, their increased weight and packaging, which affects transport emissions. Often they have specific storage requirements that require refrigeration and cold supply chains. And there's lots of other challenges around liquid medicines, around dosing errors, around taste, around storage, etc. But the real negative environmental impact of liquid medicines is related to waste and inappropriate disposal of waste medicine. So this example is just looking at a 7-day course of amoxicillin. And if you prescribe that as a liquid, it's 105 mils, so 95 mils of your 2 bottles will be wasted. Most courses are 5 days of amoxicillin 3 times a day, which is 75 mils. So why do they not make 75 ml bottles of amoxicillin? Because at the moment, every time you prescribe that, 25 mils will be wasted. And in many cases, that will go down the sink because people will just pour it down the sink or the toilet rather than taking it back to the pharmacy. So a really great intervention is to teach people how to swallow tablets. And you're probably aware of the Kids Meds project, where they have developed an initiative to teach children as young as 4 to swallow tablets and capsules. And this enables then, families, it's much easier for families. There's really good positive feedback from families that it's easier to transport solid oral dosage forms if they're traveling or having to take medicines to school, etc. So this might be a really good project that you could think about identifying those patients in your practice who maybe are sort of frequent users of antibiotics or have more serious illnesses like cystic fibrosis and maybe taking lots of medicines, and looking at, can you teach those children and their families to swallow medicines? So there's lots of ways we can engage in sustainable practice around prescribing and primary care. Just 3 really good sources of information to go to. The BMJ Sustainable Practice, you can sort of filter this by sector, so sort of pick out initiatives that are specific to primary care. The Greener Practice platform has a quality improvement project library where you can pick out, again, quick projects off the shelf and run those in your practices. And the Centre for Sustainable Healthcare network community, we have a whole range of networks which are free to join. There's one specifically for pharmacy, one for primary care, there's one for nurses, there's one for respiratory. We have, I think, over 40 networks now. And again, lots of great examples of case studies and pieces of work that are going on around the country, including lots from Wales, on sustainable healthcare. For the pharmacy network, we regularly run online events to share people's projects and sort of to share that learning and encourage other people sort of to take up those projects. and that's all freely available on YouTube. And if you're doing some interesting work, I'd really encourage you to get in touch with me, and we'd be really happy to showcase your work at one of our events. So really quickly, just to finish off, thinking about sustainable resource use. I took this infographic from the Public Health Wales Health and Sustainability Hub, and this is looking at what we can do to cut emissions generally, and this is like looking at people in their general sort of day-to-day life. But if we think about this in relation to our GP practices, energy is a really significant, obviously, contributor to climate change. So, I mean, if you can invest in renewable energy, but you can start really simple with just a simple switch off procedure at the end of the day or the end of a session, making sure computer monitors are switched off, making sure the kind of settings we have are energy efficient, making sure lights are switched off and non-essential equipment is switched off when leaving a room, and ensuring the heating's not left on at night or over the weekend. In terms of transport energy, we should be role modelling and encouraging active transport amongst our staff and patients, or encouraging car sharing if that's not possible. Thinking about things like streamlining appointments for patients, particularly those with multiple conditions, to reduce their number of routine attendances and associated travel. And thinking, as I said, about care home prescription ordering and delivery to see if you can reduce that. In terms of waste and consumption, thinking about kind of resources and the stuff that we use, so things like PPE, couch roll, printing paper, really looking at the process and thinking, well, do we need to use that? Do we need to use as much as we're using? You know, what can we do to change? And in food, ensuring for things like practice meetings or special occasions that we're maybe not kind of bringing in loads of ultra-processed unhealthy food, but trying to go for the more tasty, healthy food if we can, more fruit and vegetable, less processed food, and definitely minimizing food waste, especially at those sorts of meetings. And really simple things, encouraging people to think about climate change. So using Ecosia as a search engine, which uses its profits to plant trees. And lastly, connection with nature, and this is a really important one. So we know that connection with nature is really good for our mental health. We just need it as human beings. It calms our nervous systems, it calms our minds, it reduces anxiety. So we can use connection with nature as a therapeutic intervention and encourage people to spend time in nature, go and do some gardening, go and walk around the park. These examples are examples of healthcare settings who have created garden space for their patients. So the top right-hand corner is King's College London, who recently have opened a rooftop garden for their intensive care patients, so that intensive care patients can get outside and see the sky. On the left-hand side here is Vauxhall Health Centre in Liverpool, where they created a little pocket garden on their sort of the side return of their practice, and they have a group of volunteer patients who now maintain this lovely garden. And they grow herbs and flowers, and they have practice meetings out there, and staff go and eat their lunch out there. And this example of the village practice is from Islington in London, where one of my Greener practice colleagues, one of her partners really likes sunflowers, so every year he plants sunflowers out the front, and this year they're doing amazing because of the heat. But again, just gives people sight of some green plants and greenery, and puts a smile on people's faces. If you have some space around your practice, you can apply to the NHS Forest, which is a charity supported by CSH, which supports tree planting and developing green spaces. Every year we give away thousands of free trees to NHS sites to plant on their sites. And expressions of interest for that are now open. So if you have a little bit of space where you can plant some trees, would really encourage you to go to the NHS Forest. So we only have one planet, one home, and we are all, regardless of background or profession or wealth or education, we are going to be impacted by climate change and ecological breakdown. So whether we like it or not, we are in this together. So why not work together? We don't know all the answers, but we know where to begin. And this is a journey, and we need to get started. And if we've already started, we need to encourage others to join us. So we need to move forward thinking about how we can minimize the negative effects of healthcare provision on our planet, how we can adapt our health services to cope with the impacts of climate change, and how we can manage the health conditions which a changing planet is going to create. So again, I would really encourage you to use your voice where you can, see that big picture through the green lens, and make whatever changes you can. Thank you so much for your time.